Hi, I'm Dr. Jack Ringer, past president and accredited fellow with the AACD, and I want to welcome you to another video on the AACD virtual campus. So today's video is titled Digitally Designed and Manufactured Posterior Ceramic Restorations. And what's different about this, it's a technique that I'm going to go over to make highly accurate, efficient, aesthetic, and less expensive posterior ceramic restorations. So, what is the objective of this program? We want to describe an efficient, accurate, and profitable protocol for successfully creating posterior ceramics modellessly. And just keep that in mind. We're talking about going through a treatment modality that a lot of us would probably be uncomfortable about, is making ceramics without a model. So, here are some of our objectives, though. We have to first satisfy the patient's needs, okay? So, as a dentist, we have to make sure things are biologically sound. We want conservative preparations, good marginal seal, ideal tooth form and shape, normal emergence profile. It must be functionally sound. We have to check for occlusion and guidances, along with TMJ health. And we want it to be periodontally sound. But what about satisfying the patient's desires? Okay? They have certain expectations. They want it to look a certain way. They want it to have reasonable value, reasonable life expectancy, obviously clinically healthy, and meaning like comfortable and functions well. And what's really important for both you, meaning the dentist, and the patient, is that they had a positive experience in the practice, because that's going to lead to future marketing assistance. But that's dealing with the patient side. Now what about the team's needs and desires? Okay? So the same story here. There's certain things that we as the team have to master. Communications. So we have to discuss this with our patients, explain everything to them, along with other disciplines involved, like the laboratory, specifically in this scenario. We have to have a good basis of knowledge and skills in comprehensive aesthetic dentistry, specifically adhesion, the different materials, their properties, the laboratory considerations, prep design, impression taking, provisionals, and finally seating the restoration. We also want to develop some marketing skills with this, okay? So if this is something very unique and it's very cool, we can put this out on social media. Our patients can talk about it, so that helps our practices. And we want to make sure that this is a cost-effective procedure. So we want to make sure we can manage time properly and there's reasonable fees. And we also want to, again, be creating that positive experience for our patients.